Hello everyone, welcome to the Dragon Health Profile channel. In this channel, I will be presenting and elaborating medical related issues including acute and chronic disorders, pharmacology, that is the pharmacodynamics and pharmacokinetics nature of drugs, and of course nutrition. Today we'll be looking into nephrotic and nephritic syndrome and how we can differentiate them. And here on the screen to your left you can see the nephron, and to your right you can see the Bowman's capsule. The Bowman's capsule is found within the nephron. Here is the Bowman's capsule. These are the Bowman's capsule. And to your right you can see the Bowman's capsule, and within the Bowman's capsule we have the glomerulus. And the glomerulus, it is a capillary loop which allows the passage of specific molecules. And several renal diseases are caused by injury to the glomerulus, and the sign of symptoms of these diseases could range from asymptomatic proteinuria to end-stage renal disease. For today, however, we'll look into the nephrotic and nephritic syndrome and how we can differentiate these two. The nephrotic syndrome is characterized by the following factors, conditions that are displayed on the screen. Don't worry about that, we'll get that in a while. But all we need to know about nephrotic is there is a loss of proteins as there is an increased permeability of the glomerulus. This figure illustrates the pathophysiology of the nephrotic syndrome well. As we have said earlier, in the nephrotic syndrome, there is loss of proteins into the tubules due to an increased permeability of the glomerulus. And about more than 3.5 grams of proteins is lost per day in the urine, and we call that proteinuria. Since we lose a lot of proteins in the urine, there will be a decreased level of proteins in the blood, and we call that hyperproteinemia or hypoalbuminemia because albumin is the most abundant protein found in the blood. So hyperproteinemia leads to a decreased level in the oncotic pressure. And when the oncotic pressure decreases, there will be a decreased plasma volume and a decrease in the GFR. And a decrease in the GFR leads to an increased aldosterone secretion, that is water, and salt will be retained, and hence fluid will be retained in the body, leading to edema. And since we lose a lot of proteins in the urine will be frothy. Yeah, and there's the liver will have a compensatory mechanism as proteins are lost in the urine, and that compensatory mechanism, proteins, lipoproteins, and lipids are sensitized by the liver, leading to hyperlipidemia and lipiduria. There is also another important protein lost in this condition, and that is the AT3, antithrombin 3. And this leads to hypercoagulable states, which leads to DVT, deep vein thrombosis, and PE, pulmonary embolism. There are also other signs and symptoms for the nephrotic syndrome, that is lethargy, fatigue, and reduced appetite. Nephrotic syndrome. Glomerular disease associated with nephrotic syndrome are caused by inflammatory changes in the glomeruli, such as infiltration of the leukocytes or even necrosis. And nephrotic syndrome is characterized by hematuria, that is blood in the urine. There will also be mild to moderate proteinuria, and of course there will be red blood cell castus. And there will be also a decreased GFR or glomerular filtration rate, and hence there will be an increased or elevated level of blood urea, nitrogen, and creatinine levels. There will be oliguria, condition known as oliguria, that is a decreased urine output. There will also be salt and water retention to compensate for the decreased GFR. and hence leads to edema. And since there will be a lack of filtration, there will be an increased level in the blood pressure and hence leads to hypertension. That's all for today, you guys. Thank you, and please don't forget to comment any topic you think we shall cover next time, and please subscribe to the channel. See you next time.